Thank you so much for joining me yet again. Now, today, just like has been the case for the past 2 videos that I've not done alone, I have Dr. Beatrice with me, a counseling psychologist and an addiction treatment expert. And today she's going to help us understand the topic of addiction even more. And now, let us bring her on board. Karibu sana daktari.
Asante. Thank you so much
for
having me.
Thank you so much, daktari.
Yes.
It's always a pleasure when we have you on set.
Yes.
So today we continue with what we have been doing, understanding the topic of addiction to substances even more.
Yes.
And so today we would like you to assist us with understanding on why are some people more prone to addiction and not more than others. You know, like you have heard people say, I have been drinking with my friend and now I'm here. Actually, I've been working in a clinical setting and I've seen this. But you see a person, they have been drinking with their friends, but they are the one who become addicted.
Yeah.
And so the question often is, what is this that is making some people more predisposed to addiction compared to the others? And now we understand there could be a number of factors and we would like to delve deeper into them. Yeah. And we want to start with the topic of hereditary factors and how they increase the risk of addiction.
Okay. So thank you, Jennifer. And like you have rightly put it, you can be drinking with someone for 10 years, 5 years. One person gets addicted. Same volume, same brand of, and same substance.
Yes.
One person gets addicted, another one doesn't get addicted. And the reason is because of what we call the underlying factors. Underlying factors means when I take that substance, what does it find in my system? What does it find in me? There are those who they take the substance, but they may not have many underlying factors, and even if they have underlying factors, they are not significant enough to push the drinking into an addiction. And one of the underlying factors is what you have rightly pointed out as the hereditary factor. That yes, sometimes addiction runs in a family.
Yes.
And the people can inherit the disease of addiction. By, we talk about the imbalance, in the brain, and that can be inherited. Yes. It can be passed from one parent to another. And that is why when we admit someone who has an addiction, we have to do a genogram. We have to look at the family history so that we understand why is this person suffering from addiction.
Yes. Is
it in the family or is it because of other factors? Because you must rule out every other factor until you arrive at the correct reason why someone has an addiction. So that then you can develop a treatment plan that is appropriate. So it can be inherited, and that's why, like I've mentioned, when you do that genogram, you will find that there is an uncle, there is a father, there is a mother who suffered the same problem with addiction. So that is one of the factors that we can be using substances, but if in my family, if it runs in my family, I will get addicted more quickly than
another person who doesn't have that in the family.
Yes.
And as I like to say, we are built differently.
Yes.
So you cannot say that, and I usually tell this by the way to the young people, the youth, the high school students. I usually tell them, you cannot say that you're going to drink because your friends are going to drink, drinking.
Yeah.
Because you are different. You may be seeing them, they are drinking and they seem to be okay.
Yeah.
You see another, and yourself, you take the same drug, the same amount, and you end up with issues. And yes, I have seen students with addiction. Yeah. After drinking for a very short time, or taking bangi or whatever substance for a very short time, and they become addicted.
Yes.
So thank you so much for helping us understand the issue of addiction from that perspective.
Yes.
Now, again, we would want to understand poor mental health as a factor that increases the chances of a person becoming addicted, as compared to a person with healthy mental health.
Thank you. What I would want our viewers to understand is that addiction is just a fruit on a tree, but there are roots that are helping that fruit to grow, and that's why sometimes people try to help their loved ones from becoming addicted by just cutting that fruit. You take your son, you send him to his grandmother so that he does not access the drugs, or you take him far away to a place where you think he will not access. Okay, you have cut the fruit, but if the roots, the soil is still fertile,
yes,
there is another fruit that is going to grow. He may stop using that substance and then get into another addiction. Maybe he gets into gambling, he becomes a workaholic, because the roots are still very strong.
yes,
And so when we try to treat people who have an addiction, we look at what lies at the roots
yes,
of
correct.
the addiction tree. And one of the strong roots is what you have mentioned about poor mental health.
Yes,
And what we mean by this is that sometimes when you screen someone who has an addiction, you find that they have mental health issues or mental illness. They could be having anxiety, they could be having depression, they could be having bipolar disorder,
yes,
or maybe schizophrenia. And when someone has a depression, we know that depression is a disease of hopelessness.
yes, yes,
And someone feels sad most of the time. They isolate themselves, and when they come into contact with drugs, for the first time they feel happy,
yes,
they feel excited. And so now you have taught the mind what to do when you feel sad. And so a person who has depression, they will get addicted to that experience. That there is a drug that can lift them up.
yes,
There is a drug that can make them feel hopeful. There is a drug that will help them come out of the house and interact with other people. And so depression, also anxiety, feeling unsettled. You know, anxiety, is a disease that makes people feel unsettled, fearing that the worst is going to happen.
yes,
Even fearing, interacting with other people, that anxiety. But when you take a drug and for the first time you feel calm, that experience is what someone gets addicted
yes,
to.
yes,
Also issues of schizophrenia, the fact that the decision-making process is interfered with by that mental illness.
yes,
And so there are people who will indulge into substances because of poor decision making, and also so many mental illnesses, because one thing that poor mental health does is that it interferes with decision making process.
yes,
It also interferes with judgment, meaning that when you're supposed to choose between A and B, you can't make a good decision because of the disease. And so you find people make poor decisions, they indulge in drugs, and then they get addicted. So poor mental health, and also just living in an environment that is compromised. When someone has extreme stress,
yes,
because of family issues, or maybe work issues, or school issues, that will also interfere with the mental health of a person,
yes.
and they may look for drugs as a way of escape.
Okay,
Yeah.
Thank you for explaining that.
Yeah.
And also, as I can imagine, with all the stigma that comes with being mentally ill, a person may resort to using drugs to overcome the stigma so that they can be able to face people.
Yeah.
And also, as I can imagine, when a person is mentally ill, most of them find themselves losing their jobs, and so on and so forth. So again, that can also push them into using substances to numb the frustration and the disappointment.
Exactly.
Because we know we live in a society where there is so much stigma. When a person is mentally ill, they are viewed as incapable of doing things. Well, because we know that it is not necessarily the case.
Yes.
Some levels of illnesses you can still function.
Yeah.
Yeah. So thank you so much for explaining that, Dr. The other factor that we want to know how it makes it more likely that a person is going to become addicted is what we call childhood trauma.
Yes.
So childhood trauma, what is the interplay between having gone through or having childhood trauma and becoming addicted?
Okay. Thank you for that. Childhood trauma, or what we call adverse childhood experiences. These are experiences of abandonment, where a parent abandons the children by either walking away or even emotional abandonment. You can have parents who are too busy or who are too engrossed in their own challenges, such that you suffer what we call existential vacuum, that the parent is there but you are not feeling them because they are lost in their own world. And so children who grow in that kind of environment, they grow up feeling unworthy of somebody's attention. They grow up feeling, you know, like they don't matter.
Yes.
They grow up feeling unsafe and exposed, because when you have been abandoned, it means that there are issues of their security issues.
Yes.
If, for example, children are being left alone, and we know there are cases where parents maybe go out and they leave children alone. We have had cases of children who burn in the house because the parents have left. You know, those issues of abandonment, issues of neglect, issues of violence, physical, psychological, also issues of sexual abuse. And so we talk about addiction as a way of escape.
Yes.
Because when a child grows up in this kind of an environment, when they are adults, when they are mature, when they are young, they are young, they want to forget what they went through. They want to numb those memories. And when they take their drugs, when they take their substances, for the first time they can feel like they belong.
Yes.
When they visit their friends in the drinking den, and they are being appreciated. Because one other thing that a child suffers is lack of affirmation,
Yes.
lack of appreciation, you know, being discounted, meaning that no one, you know, seems to notice when good things are happening, when bad things are happening, the reaction is the same.
Yes.
And so the child grows up feeling unappreciated. And when they fall into the company of people who are appreciating them, then they get addicted to that experience. And sometimes young people will fall into the hands of their drinking buddies. And as they go there to feel wanted and to belong, then issues of drug abuse also come into play. And we have also talked about that fear that is instilled in children who suffer violence. And this fear makes them have low self-esteem. They feel like, you know, like they don't belong. And this fear is only countered when someone takes drugs and for the first time they can address people. A boy can approach a girl, something that they could not do before. And so you have given your brain a solution that whenever you need to do an assignment where you have to appear before people, or there is a challenge where you need to approach a girl, then you know what to do. And sometimes it is the use of those substances. And so they get addicted to that. Because we are saying addiction is a way of escape, like I said. And it is also an attempt to medicate an inner pain. This inner pain is what we are calling childhood wounds. And so they will be trying to medicate that abandonment, the neglect, the feeling of unworthiness, you know, that even the voices of the violent people in the family, they'll be attempting to silence those voices using substances. And that's why a lot of research has been done to, you know, establish the connection between adverse childhood experiences and addiction. And the results are alarming, because the percentages are over 60%. That when you get like 10 people who have issues of addiction, and you engage a reverse gear to look at their upbringing, you will find that most of them, you will think they are brothers and sisters, because the experiences they'll be talking about, oh, my father left us, my parents used to fight, or someone died, you know, because even losing a significant person in the family when someone is young is also an adverse childhood experience. And that pain, unless there is an intervention, then that pain will continue in that person, and they'll be trying to numb that pain. Because we say that when a child is hurt when they are growing up, we call them childhood wounds. And that child does not go anywhere. Even when I'm in my 50s or in my 60s, that child is still within me. And so there are times when I'll be responding to issues from my painful background. My younger wounded self will be responding to adult issues. And there you find that person gets into a lot of conflict. So childhood experiences, especially when they are negative, have a very, very strong correlation with substance abuse.
Okay. Yes. Thank you so much for explaining that. And now that we are curious, for that person who just realized that they are predisposed to addiction.
Yeah.
Either because there are people in their family who are addicted, or because they have mental health issues.
Yeah.
And we know mental health issues, they don't necessarily have to be the mental disorders. It can also be issues like low self-esteem,
Yes.
and so on. The seemingly smaller issues.
Yes.
And also a person who has who had childhood trauma, and now they feel they are predisposed to getting addicted. How would you advise them? How should they go about living their life in as far as consumption of substances of abuse is concerned?
Yeah, okay. What we are doing as mental health enthusiasts, because I call myself an enthusiast, I'm very passionate about issues mental health and issues of addiction, is creating awareness.
Yes.
Because for those who are already addicted, is to look for ways of helping them, connecting them with where they can get help.
Yes.
Those who need to be rehabilitated, they need to have that service offered to them. But the key thing that we are doing today is educating parents, okay? So that parents know that when I do this to my child, this is what I expect.
Yes.
This is the outcome I expect from my child. And so you become very intentional as a parent. We go back to the drawing board and we focus on the future, and you ask yourself, what kind of child what kind of teenager do I want from this 3-year-old? What kind of adult do I want from this 10-year-old? And so you go back to the drawing board and ask yourself, so what is it that I need to do?
Yes.
We know that there are issues of attachment. Ensure that there is bonding with the child. Ensure that there is affirmation, so that the child grows up knowing that they have a fallback plan, even when challenges come. Because what we are seeing with young people today is lack of resilience. They give up easily, and when they give up, then they are looking back and like they don't feel that they have enough support from their parents. So it is about creating awareness, helping parents to become intentional in the way they are bringing up their children, pointing out what are these that we are calling adverse childhood experiences. You point them out clearly. 1, 2, 3, 4. Don't do this to your child, because it will affect them. You may find them becoming suicidal in future. You may find them getting into drug abuse. They may end up in prison, or they may even end up dead. So those are some of the things that we are doing. And for the youth, it's about sharing information about how they can be assisted, getting peer support, like peer counseling, where you have champions among the youth to work with their peers, showing them how to deal with their problems, and also assuring them that if they are struggling with issues of addiction, then help is available. The worst that someone can do is to hide a problem, because it becomes worse. So it's about sharing information, creating awareness of how someone who is already in addiction can be assisted. Also helping parents, because we need to save a whole generation. That parents now become intentional, because there are those parents who inflict these psychological wounds on their children unknowingly, because they don't know that if I do this, they are not even aware what would happen, what will happen to that child when you subject them to some environment. And also helping even those parents themselves to deal with their own traumas, because some of these traumas are historical, from the time when our parents were fighting in the Mau Mau War. They were traumatized by the Wazungus, and now they are passing on this trauma to their children. You see, because we say you can't give what you don't have.
Exactly.
If I have wounds of my own, I will do what I know best. If I was taught that when a child does something wrong, you slap, you beat, you deny food, if that is the kind of way I was taught to discipline, then I discipline my children the same way. And so these wounds, we keep transmitting them from one generation to another. And the only way we can break that chain is by telling parents, hey, please, this has to stop. We can become the weak part of this chain by, being aware of how we need to raise our children so that they can be resilient, so that they can be optimistic, to know that if one thing fails, there's still another day to try another thing.
Yes.
Because like what I've said, most young people, they are giving up very easy. They don't have resilience. It's because of lack of optimism. So this is what we need. We need very, robust programs for young people, programs for parents, programs in schools, programs in universities, so that everyone can be aware that this is an issue that can be handled in a very deliberate manner, so that the generation that is coming will have better mental health.
Okay, thank you. You have explained it so well. I hope our viewer has understood where the hope lies, what can be done to be proactive in dealing with this issue instead of waiting until it happens and then you say, as Fulani, they were more predisposed and now that this is why they are addicted. So we can go back and actually look at those predisposing factors. Dr. Beatrice Mainge is the founder and director of Nobility House Treatment and Rehab Center. It's located near the city of Nairobi in Kenya. So if you have a person who is struggling with addiction, you can get in contact with her. I've gone to her facility. It's a NOSAM facility, and by the one of these days I'm going to visit, and we are going to do a session with you from there. Because it's a NOSAM facility, and I've seen what it does to its clients. So, Dr. Beatrice, tell us how we can be able to reach you for a person who would want you to help them.
Okay. So thank you, Jennifer. All this information that I'm sharing, because I call myself a mental health enthusiast, because of the passion that I have for issues of mental health. And I thought, how do I contain all this energy? How do I house this energy to help other people? And that is how we set up Nobility House Treatment and Rehabilitation Center. It is situated in Kiambu, and we admit both males and females, and we run what we call a bio-psychosocial spiritual model. Why that? Because bio takes care of those issues that we have talked about, the mental health issues. And so we have doctors on board. So if a doctor screens and they find that there is an underlying issue that requires medication, we have medication for that. That's why we have doctors, psychiatrists. And then we have psychologists who now deal with the psychological issues. The underlying issues, like we have said, issues of childhood traumas and all that. So that we run what we call a trauma-informed care. We don't like to ignore the fact that someone may have gone through childhood experiences. And also we have our nurses, we have also the spiritual component, because we believe that also reconnecting people with the higher power is one of the strategies. Because sometimes when we detach from the higher power and we don't preach to our people and telling them you need to be born again, I don't preach that to them. I don't tell them about my God. I tell them about the God of your understanding. What is your understanding about the higher power? Then connect with Him, because it's also psychologically relieving when you know that you can actually commit your issues to a higher power. Okay, and that gives you some relief. So we run what we call a bio-psychosocial spiritual model, a 90 days program. It's a menu of activities each and every day, just to try and help people regain their nobility. That's why we call ourselves a Nobility Center, where we restore human dignity. Once a person leaves the place feeling dignified, then they'll be saying to themselves, I cannot be seen in this day. I cannot be seen like this because I am a noble. And so we release them to stand on their own and to be self-regulating. Our phone number is 0791 825 044. Again, 0791 825 044.
Thank you so much, Dr. for coming. We honestly look forward to having another time with you. You are teaching us so much. We are now getting to understand why people behave the way they do, and what we can do in as far as the topic of addiction is concerned. So our viewers, thank you so much for joining us. And remember to join us next time. We appreciate your presence all the time. Thank you.